Hello and welcome back to Silvercare Daily, your go-to channel for trusted health advice and practical tips specially designed for seniors and their families. Before we jump into today's video, let me share a startling fact with you. Every 40 seconds, somewhere in the world, someone suffers a stroke. That's nearly 800,000 strokes each year in the United States alone, making stroke one of the leading causes of serious disability and death among older adults. The risk only increases as we age, and the consequences can be devastating, not just for the person affected, but for their loved ones too. But here's the twist that might surprise you. Some of the most commonly taken vitamins, which millions of seniors rely on daily to support their bones, hearts, and brains, may actually be silently increasing the risk of stroke and other serious brain injuries, especially when taken in the wrong amounts or at the wrong time. It's a hidden danger many people don't talk about, and that's exactly why we made this video. Because knowing the truth could literally save your life or the life of someone you care about. Before we get into the details, I want to ask you to take just a moment to like this video, share it with friends and family, and subscribe to Silvercare Daily. Your support encourages us to keep creating honest, science-backed health content to empower seniors every day. So buckle up, stay with me through this video, because what you're about to learn isn't just important, it's potentially life-changing. Let's protect our brains, our bodies, and our futures together. Alright, let's get started. 5. Vitamin A good for vision, but pressure on the brain. Vitamin A is widely recognized as a vital nutrient for maintaining healthy eyesight, supporting immune function, and promoting skin health. Many seniors rely on vitamin A supplements or formulas designed for eye health and anti-aging, believing they are taking proactive steps to preserve their quality of life. However, the truth is that too much vitamin A, especially when taken over a long period, can quietly and dangerously accumulate in the body, leading to serious health issues, particularly increased pressure inside the skull. Unlike water-soluble vitamins such as vitamin C or the B-complex group, vitamin A is fat-soluble. This means it is stored in the liver, fat tissues, and even in the brain. Because the body doesn't easily get rid of excess vitamin A, it can build up over time, especially in older adults whose liver function and metabolism slow down with age. This buildup can result in a condition called pseudotumor cerebri, also known as false brain tumor, where increased intracranial pressure mimics the symptoms of a brain tumor but without an actual growth. The symptoms of pseudotumor cerebri include persistent and severe headaches, blurred or double vision, dizziness, nausea, and sometimes slurred speech or difficulty maintaining balance. These symptoms are often confused with normal signs of aging, migraines, or other neurological conditions, which can delay proper diagnosis and treatment. If this condition is left untreated, it can cause permanent damage to the optic nerve, leading to irreversible vision loss and even cognitive decline. Data from the National Institutes of Health emphasize that older adults should not exceed a daily vitamin A intake of around 2,500 to 3,000 IU unless under strict medical supervision. Despite this, many over-the-counter supplements, especially those marketed for skin care, eye health, or anti-aging, contain doses of vitamin A far exceeding this safe limit, sometimes as high as 5,000 to 10,000 IU per dose. This presents a hidden risk for seniors who may be taking multiple supplements without realizing the combined effect. Adding to the danger is the common habit of stacking supplements, using a multivitamin alongside specialized products containing vitamin A. This unintentional overdose can rapidly increase the amount of vitamin A stored in the body, elevating the risk of toxicity and the dangerous symptoms it causes. Seniors need to be particularly cautious because their bodies process nutrients differently than when they were younger. Liver efficiency decreases with age, and the ability to metabolize and clear fat-soluble vitamins slows down, making vitamin A buildup more likely. It's crucial to understand that taking more vitamin A doesn't necessarily mean better health outcomes. In fact, excessive intake can be more harmful than beneficial. Natural dietary sources such as carrots, sweet potatoes, spinach, kale, liver, and dairy products generally provide enough vitamin A to meet daily needs safely, without the risks associated with high-dose supplements. Here's an important question for you to consider. Have you ever thought about how much vitamin A you're really getting from all your supplements combined? Are you aware that some supplements might be doubling or even tripling your daily intake without your knowledge? These are critical considerations for anyone over 60 who wants to protect their brain health, eyesight, and overall well-being. By paying close attention to supplement labels and consulting healthcare providers before adding or combining vitamin A-containing products, seniors can avoid the silent dangers of vitamin A toxicity. After all, protecting your brain and vision is about balance and knowledge, not just taking more pills. 4. Vitamin B6, nerve support or nerve destroyer? Vitamin B6, also called pyridoxine, is widely recognized for its vital role in supporting nerve health, brain function, and energy metabolism. It helps convert food into usable energy, supports the production of neurotransmitters, and assists in maintaining proper brain chemistry. Because of these benefits, vitamin B6 is often a key ingredient in many brain-boosting, memory-enhancing, and energy supplements, especially those marketed towards seniors who want to maintain mental sharpness and physical vitality. However, despite its essential functions, vitamin B6 carries a hidden risk when consumed in excessive amounts over time. The problem arises with prolonged intake of high doses of vitamin B6, which can actually cause damage to your peripheral nerves, the nerves that send signals from your brain and spinal cord to the rest of your body. This nerve damage, known as peripheral neuropathy, can lead to symptoms such as numbness, tingling sensations often described as pins and needles, burning sensations, weakness, and poor balance or coordination. Imagine the nerves as electrical wires that send important messages throughout your body. Vitamin B6 overdose can strip away the protective insulation around these wires, making them vulnerable to malfunction. This insulation is called the myelin sheath, and when damaged, your nerve signals become disrupted, leading to those troubling symptoms. Unlike many water-soluble vitamins that your body quickly eliminates, vitamin B6 is absorbed and stored in tissues, meaning it can accumulate if taken excessively. This buildup happens gradually and quietly, often without immediate warning signs, which is why the damage can go unnoticed until symptoms become severe and persistent. The insidious nature of this condition makes it particularly dangerous for older adults, who may already be experiencing some degree of sensory decline. Health authorities such as the National Institutes of Health recommend that older adults limit their vitamin B6 intake to between 10 and 25 milligrams per day. However, many over-the-counter supplements and multivitamins contain doses far exceeding this safe range, sometimes 50 milligrams, 100 milligrams, or even more per serving. Seniors taking multiple supplements simultaneously may unknowingly consume dangerously high amounts of B6, significantly increasing the risk of nerve damage. Clinical evidence and case reports have documented numerous instances where individuals taking excessive vitamin B6 over several months began developing peripheral neuropathy symptoms. In one notable study, patients reported numbness and tingling in their hands and feet, followed by difficulties with balance and coordination, which initially were mistaken for normal aging or other neurological conditions. This misdiagnosis often delayed appropriate treatment, allowing the nerve damage to worsen and become irreversible in some cases. So, Here's an important question for you to consider. Are you tracking how much vitamin B6 you consume daily from all your supplements and fortified foods combined? Have you noticed any unexplained numbness, tingling, or balance problems that could be related to excessive B6 intake? If so, it's critical to consult your healthcare provider for an evaluation and possible adjustment of your supplement regimen. Ultimately, vitamin B6 is undeniably beneficial when consumed within safe limits, but like many nutrients, it carries risks if overused. The key is moderation and awareness, knowing your total intake and staying within recommended limits to protect your nerves and overall health. By being cautious and informed, you can safely enjoy the positive effects of vitamin B6 without risking long-term nerve damage. 3. Vitamin B3, lower cholesterol, but raise blood pressure. Vitamin B3, also known as niacin, has long been praised for its ability to improve cholesterol levels and promote cardiovascular health. It is often included in supplements aimed at reducing bad LDL cholesterol and raising good HDL cholesterol. Many people take niacin-based supplements hoping to protect their hearts and reduce their risk of heart disease. However, what many don't realize is that while niacin can be beneficial in moderate amounts, excessive intake, especially doses over 500 milligrams per day, can cause serious cardiovascular side effects that may actually increase the risk of stroke. The main problem lies in how niacin affects your blood vessels. When you take niacin, it initially causes your blood vessels to dilate or widen. This sudden expansion can create a flushing sensation, which is often described as warmth or redness of the skin, usually on the face and neck. This niacin flush is uncomfortable for many but is usually harmless in moderate doses. However, after this dilation phase, the blood vessels can suddenly constrict or narrow. This rapid narrowing is dangerous because it causes an abrupt increase in blood pressure. This rapid spike in blood pressure places excessive strain on the cardiovascular system. When blood vessels constrict sharply after initially dilating, it disrupts the smooth flow of blood to vital organs, especially the brain. Such sudden fluctuations in blood pressure increase the risk of small blockages or reduced blood flow to brain tissues, leading to what doctors call transient ischemic attacks, or TIAs. TIAs are often referred to as mini-strokes because they produce stroke-like symptoms such as weakness, numbness, confusion, difficulty speaking, or vision problems. Although these symptoms usually resolve within a few minutes to hours without causing permanent damage, they are important warning signs. Experiencing a TIA means you are at much higher risk for a full-blown stroke in the future, which can cause permanent disability or death. Because of these risks, health authorities recommend limiting vitamin B3 intake to less than 50 milligrams per day for general use, unless a doctor prescribes a higher dose for a specific medical reason and monitors you closely. Prescription niacin is sometimes used to treat severe cholesterol problems, but only under medical supervision due to these potential cardiovascular side effects. It's important to remember that many over-the-counter supplements marketed for heart health and cholesterol control contain niacin doses far above this limit, often in extended-release or flush-free forms. Despite these marketing claims, the risk of blood vessel constriction and blood pressure spikes remains a serious concern, especially in older adults or those with existing cardiovascular issues. To emphasize just how critical managing blood pressure spikes is, the American Heart Association reports that uncontrolled high blood pressure is the leading cause of stroke globally, accounting for millions of deaths every year. This makes it clear that even vitamins intended to support heart health, if taken improperly, can have the opposite effect and raise the risk of life-threatening events like strokes. Here's a question to consider. Do you know the exact amount of vitamin B3 you're taking in your supplements or medications? Have you ever noticed symptoms like sudden dizziness, headaches, or flushing after taking niacin? If so, these might be signs that your dose is too high or your body is reacting negatively. It's very important to discuss these symptoms with your healthcare provider to ensure your vitamin intake is safe and effective. In conclusion, while vitamin B3 has proven benefits for cholesterol management and heart health, it requires careful dosing and medical supervision to avoid serious side effects. Understanding the delicate balance between beneficial and harmful doses can protect your cardiovascular system from dangerous blood pressure spikes and reduce your risk of mini-strokes and full strokes. 2. Vitamin E, heart helper or silent brain bleeder? Vitamin E is often praised as a powerful antioxidant and a supporter of cardiovascular health. Many seniors take it hoping it will protect their heart, improve circulation, and even slow down aging processes. While vitamin E does have benefits in moderate amounts, taking too much can turn those benefits into serious risks, especially for older adults. One of the main risks of high-dose vitamin E supplementation is its strong blood-thinning effect. At doses between 200 to 1,000 international units per day, vitamin E acts almost like a natural blood thinner or anticoagulant. This thinning effect helps prevent harmful blood clots that can cause heart attacks or ischemic strokes. However, this also means your blood is less able to clot when you have a bleed or injury, raising the risk of dangerous bleeding events. Among the most serious of these bleeding events is brain hemorrhage, also called a hemorrhagic stroke. This occurs when a weakened blood vessel in the brain bursts, causing bleeding into the brain tissue. Unlike ischemic strokes, which are caused by blood clots blocking vessels, hemorrhagic strokes involve active bleeding that can rapidly increase pressure inside the skull, damaging brain cells and sometimes leading to permanent disability or death. This risk is especially important for seniors because as we age, our blood vessels become more fragile and more susceptible to damage. If someone is already taking blood-thinning medications like aspirin, warfarin, or Plavix to prevent clots, adding high doses of vitamin E can dangerously amplify the blood-thinning effect. This combination has been shown to increase the likelihood of brain hemorrhage significantly. According to the National Institutes of Health, the recommended safe intake of vitamin E for older adults is around 22 IU or 15 milligrams per day. This is the amount naturally found in a balanced diet that includes foods like almonds, sunflower seeds, spinach, and avocados. These foods provide enough vitamin E for antioxidant protection without the dangers of excess. A large study published in the Journal of the American Medical Association tracked thousands of older adults and found that those taking over 400 IU of vitamin E daily had a notably higher risk of hemorrhagic stroke compared to those who consumed vitamin E from food or low-dose supplements. This data clearly shows that megadosing on vitamin E supplements can be hazardous. Many people think that because vitamins are natural, taking more will only help, but that's a dangerous misconception. For example, consider a senior who self-medicates with high-dose vitamin E supplements alongside prescribed blood thinners without medical guidance. They may unknowingly increase their risk of brain hemorrhage, which could have devastating consequences. Do you know how much vitamin E you're currently getting every day? Have you ever talked with your healthcare provider about your supplement regimen, especially if you're on blood thinners? These are critical questions because your safety depends on understanding how supplements interact with medications and your body's changing needs as you age. In conclusion, while vitamin E can indeed act as a heart helper by protecting cells from damage and supporting healthy circulation, excessive supplementation without professional advice can turn it into a silent brain bleeder. Protecting your senior health means staying informed, avoiding unnecessary high doses, and always consulting your doctor before adding or increasing supplements, especially if you're on blood thinners. 1. Vitamin D, the silent stroke trigger while you sleep. Vitamin D is widely known as the sunshine vitamin because our bodies produce it when exposed to sunlight. It plays a crucial role in maintaining strong bones, regulating the immune system, and supporting overall health, especially for seniors who may spend less time outdoors or live in regions with limited sun exposure. Many older adults rely on vitamin D supplements to prevent osteoporosis and maintain vitality. However, while vitamin D is undeniably essential, taking it in excessive amounts can have unintended and potentially dangerous consequences. One of the most concerning risks of high-dose vitamin D supplementation is its potential to increase the risk of stroke, particularly silent strokes that can occur during sleep without obvious symptoms. But why does this happen? When you take very high doses of vitamin D, typically in the range of 5,000 to 10,000 international units, IU, per day, your body's calcium levels can rise above normal. This condition, known as hypercalcemia, means there's too much calcium circulating in the bloodstream. Although calcium is vital for bone strength, excess calcium doesn't just stop there. It can deposit in soft tissues, including the arteries that supply blood to your brain. Over time, these calcium deposits lead to stiffening and hardening of your blood vessels, a process called arteriosclerosis. When arteries become stiff and narrow, it's much harder for blood to flow freely and deliver oxygen and nutrients to brain tissue. This restricted blood flow can result in tiny areas of brain damage called silent strokes. Silent strokes are particularly dangerous because, unlike the dramatic symptoms of a major stroke, such as paralysis or loss of speech, they often go unnoticed. Yet, the damage they cause adds up, increasing the risk of cognitive decline, memory problems, and making future strokes more likely. Essentially, these hidden strokes chip away at your brain health quietly but significantly. What's more surprising is that the timing of vitamin D supplementation might influence this risk. Emerging research suggests that taking high doses of vitamin D late in the day or right before bed may increase the chance of silent strokes during sleep. The reasoning behind this is that calcium levels fluctuate naturally with your body's circadian rhythm, and excess calcium at night might promote vascular stiffness and plaque buildup when your body is supposed to be resting and repairing. The National Institutes of Health recommends a safe upper intake level of about 2,000 IU per day for older adults unless a deficiency is diagnosed and closely monitored by a healthcare professional. Unfortunately, many people self-prescribe much higher doses without blood tests or medical advice, unaware of the risks. To put this into context, a large-scale observational study involving thousands of participants showed that individuals taking more than 4,000 IU of vitamin D daily without medical supervision had a significantly increased risk of silent strokes detected through brain imaging. This important finding underscores the hidden dangers of excessive vitamin D supplementation, especially among seniors who may already be at higher cardiovascular risk. Have you ever had your vitamin D levels tested by a doctor? Do you know how much vitamin D you are currently taking, and at what time of day? These are important questions that everyone should consider before adjusting their supplement routine. In summary, while vitamin D remains a vital nutrient for healthy aging and disease prevention, it's critical to balance its benefits with caution. Overconsumption, especially of high doses taken at night, may silently increase your risk of stroke by causing calcium buildup and artery stiffening in the brain. To safeguard your senior health, stick to recommended doses, get regular blood tests, and always consult your healthcare provider before making changes to your supplement regimen. Remember, taking care of your brain health isn't just about adding supplements, it's about making informed, careful decisions that protect you now and for the future. Thank you so much for sticking with us until the end here on Silvercare Daily. I truly hope this video has opened your eyes to some of the hidden dangers that can come from taking certain vitamins without proper guidance, especially for seniors like you and your loved ones. It's important to remember that vitamins are powerful substances, and while they can support your health when used correctly, they can also quietly cause serious harm if misused. That's why awareness is your most powerful tool. Knowing what to take, how much to take, and when to take it can make all the difference between protecting your brain and putting it at risk. Your health journey is unique, so please always consult your healthcare provider before adding or changing any supplements. Blood tests, professional advice, and personalized plans matter more than one-size-fits-all solutions. If this video gave you useful information or made you think twice about your current vitamin routine, please like this video and share it with your friends, family, or anyone you know who might benefit. The more people we can reach, the more lives we can help protect from stroke and other serious brain health risks. Also, don't forget to subscribe to Silvercare Daily and hit the notification bell so you never miss out on our latest health tips, expert advice, and inspiring stories made just for seniors. Remember, it's never too late to take control of your health. Every step you take counts towards a stronger, sharper, and more vibrant you. Thank you again for watching. Take care, stay safe, and I'll see you in the next video right here on Silvercare Daily.